Free birth. I don't love that at all. The Pitt.
Gar 5.
5 out of 10, not great.
Lots of stories about obstetrical violence. Wait a minute. Is this common in the States? He just say it's about as bad as it can get, and then she coded. I lie. I lied. I watched it. Of course I watched it. It's the Pitt. But I didn't watch it with you, so we're going to go over it together. And then I can do any splaining that needs to be splained. Okay? Also, trigger warning, lots of sort of catastrophic pregnancy stuff is going to happen in this episode. So if you are not in a headspace that you want to partake in that, I totally get it. Just scroll on, Queen. You scroll on and you go find something that brings your heart joy. Okay, here we go.
Hey, Dr. Robbie, this is student Lestrade, 36 weeks pregnant with 2 days of headache.
Almost
now a 10 out of 10 with blurred vision. BP 174/120, heart rate 92, no relief with fentanyl.
Okay, so very classic preeclampsia signs. Preeclampsia is going to be high blood pressure in pregnancy with some other organ functions that are becoming impaired as well. These are really, really classic signs.
Relief with fentanyl.
Judith, I'm Dr. Abbott. Any weakness in your arms or legs?
No. Is this a stroke?
We need to check for everything.
Pitting edema, severe preeclampsia.
I don't know whose legs those were, but give that person an award for having pitting edema that they used as a prop. Thank you. Because that's some the pitting edema, like when you push it and it doesn't come back out, it's like their legs are so swollen. Very, very typical with preeclampsia.
Where are you doing your prenatal care?
Nowhere. It's a wild pregnancy. I want a free birth.
Okay, so free birth. This is something that is, I would say, getting more traction. There has been a couple of stories on social media that have gotten a lot of exposure lately about free birth. So free birth is when you are giving birth at home or somewhere else where there's no help from medical professionals or anybody with medical training. Very different from a home birth where you're giving birth in your home with somebody who is medically trained, usually a midwife or a registered nurse midwife. Okay, those are different things. Free birth is like, I don't want any help from anybody that has anything to do with the medical healthcare system. But I think a lot of people are actually moving into the free birth movement because of the huge distrust that is building with our healthcare system around obstetrics. Lots of stories about birth trauma that could have been avoided, lots of stories about obstetrical violence, people who are not having their wishes taken seriously. So I think a lot of times when we think about birth trauma, we're pushing people away from the healthcare system, where I think we need to be pushing the needle on change and trying to change the climate of birth. So free birth. She wants a free birth. But I'm assuming also she's having huge turmoil being in the hospital. This is everything she didn't want. So let's see.
TTG is on.
Okay, so they put the monitors on.
Cardiotachography measures the baby's heart rate and checks for contractions.
Yeah. So the bottom one is for baby's heart rate, and then the top one is going to be checking for any uterine activity. And this is usually contractions, but the way that top one works, it actually works under pressure. So when the uterus contracts, it usually comes up like this, and that will put pressure up against that pressure sensor, and it will come out as a reading. That's why you might see contractions on a monitor that are like waves like this. So really it's telling us that something is happening in the uterus. We're keeping an eye on this baby.
Feel heart rate 128. Normal range nasally?
110 to 160.
Nailed it.
So the baby's okay?
Right now, yes. 128 is reassuring.
Yep, looks good.
BP's
Pattern
170
looks
over
good.
119.
170 on 119 is elevated, so anything that is over 160 on 90, we are really taking quite seriously in pregnancy.
6 grams of magnesium running in. Your next move, Cruz? 20 labetalol IV push over 2 minutes.
Very typical medications for somebody with preeclampsia and pregnancy. You have magnesium as a drip, which, by the way, makes people feel absolutely miserable. And then labetalol would be a medication to bring down her blood pressure.
What's happening?
You have a condition called preeclampsia.
And how did that happen?
No.
Yeah, I don't love that she had to ask what's happening. So again, we're talking about birth trauma and trying to reduce birth trauma. And a lot of times communication can really go a long way in reducing somebody's birth trauma, because a lot of it comes from not feeling like you are part of the plan when it comes to your own baby's childbirth. And so I think as she was rolling in, we probably could have been talking to her instead of her having to ask, what is that you're putting on my belly? What's happening? What's going on? We're talking about medications and we're talking about instruments and we're talking about readings of your baby. So I think definitely the communication here is lacking.
Nobody really knows, actually. It affects about 10% of the pregnancies. High blood pressure, headaches, protein in the urine, and swollen ankles.
Well, it's a wild pregnancy, so that means no medical care.
Then why are you here?
I just need to get rid of this headache.
Oh, God, I love Robbie. Love.
Well, if we don't lower your blood pressure and treat with magnesium, there can be problems.
Like what?
Seizure.
Seizures, bleeding, even death for you and the baby.
So we're worried about her developing seizures, which would then no longer be preeclampsia. It would be something called eclampsia. So that's seizure activity. So it can turn into something called HELLP syndrome. It's not good.
You good?
Yeah, I'm good. I got it. My eyes closed. But I won't. Maybe one eye.
How's the headache?
So we're trying to add a little humor.
More fentanyl?
Okay, so
Yep.
headache's not improving.
BP's good. Another 50.
Hey, Abbott. Attending
Blood
resident
pressure's
are stuck
good.
in the OR.
Oh, you're the next
who's
best
this?
thing.
Who's this?
What do you got?
This is Judith, G1P0 with no prenatal care.
G1P0 means it's her first pregnancy. Like she has not had a baby, okay? If she had had a baby, she would, and it was her second pregnancy, she would be a G2P1. She's a G1P0.
Preeclampsia with severe hypertension.
Hi, Judith. Nurse Garvin from OB.
Some
Wait
jelly
a
on the back.
minute. Is this common in the States? I just know where I work, like as a nurse, I would never go down to the emergency department to like assess and admit somebody with severe preeclampsia. It would never be me as a nurse. Oh my God, I'd be so scared.
Gonna take a quick look with ultrasound.
No.
Oh.
Ultrasound can harm the baby.
Not true. Not doing the ultrasound could end up harming you and the baby.
This no ultrasound thing is also something that floats around on social media. A lot of people will say that the ultrasound waves can actually harm the baby.
Ultrasound technology has never been proven safe in any double-blind human control trials.
They still don't know the full effect on the baby.
And so if you believe that something is going to harm your baby, you will usually gravitate away from it. I truly believe that anybody making decisions for them and their baby and their pregnancy, they are making them because they truly believe that it is the best choice for them and their baby. I don't think anybody's out here making decisions because they want to harm their baby. But I think it's just, even if it's not something that I would choose, they are doing it not out of malice, but out of the fact that they think that it's best. So there is that narrative around about ultrasound causing harm.
Okay, just do it as fast
Okay,
as you
so
can.
she's kind of agreeing
Why no
reluctantly.
prenatal care, Judith?
Solid question.
I wanted a free birth. No doctors, no hospital, no medicine.
You have a midwife? A birth doula?
No, I don't need one. Women have been having children on their own for thousands of years.
Yeah, with an infant mortality rate of 30% for most of those thousands of years.
Fair.
Femur length 7 centimeters.
37 weeks. They'll probably induce.
What? No.
So again,
No.
This bothers me again. So here they're talking about her above her, which bugs me because now she's like finding out about their plan for her that she hasn't consented to or found out any other information about from them talking to each other, like she's not even in the room next to her. So I don't love that at all. The Pitt. But they're talking about induction, which would be the way that you would want to go. So the cure or the fix for the preeclampsia is going to be delivering the baby. Now, it becomes tricky when you are not as close to being term in your pregnancy. So if you have preeclampsia that comes up at like 33, 34, 35 weeks, then you're trying to weigh it out and be like, are the benefits of bringing this baby to the outside world before they are ready to be out here and fully developed, are those benefits going to outweigh that risk of preeclampsia? So sometimes they will really try to buy people time if they are not really close to full term, if they can, and manage it with medications and whatnot. But for her, it's like she is very close to 37 weeks, though I thought that they said 36 in the ambulance, and then she's like 37. Anyway, you know why that is. I just made the realization as I talked through it with you. So they did the ultrasound and they figured out somehow how far along she is based on, I think, was that cervical? Based on some sort of a length of something that they found on an ultrasound, which we know that dating ultrasounds, the later that they are in the pregnancy, the less accurate they are. So what they're saying is based on ultrasound, which she hasn't had before because she's doing a free birth and a wild pregnancy, they're thinking she's closer to 37 weeks, which would make it safer for baby to kind of come out versus being inside with severe preeclampsia. Do you like that? This is why I watch it with you guys. I had like a light bulb moment there. Anyway, so they're telling her that she might need induction because then she's going to do better with this baby out.
No. Absolutely not.
At 37 weeks,
Makes
the
sense.
cure
She
for
wouldn't want that.
preeclampsia is to deliver the baby. We need to get you upstairs so the OB doctors can induce labor to save you and your baby.
No.
Poor girl.
Hemoglobin 7.5, platelets 40,
These are sky high.
Okay, so now they're looking into her lab work.
Hemolytic anemia, elevated liver enzymes, and low platelets.
They're cleaning a room. We can bring her up in 10 minutes.
How you doing, Judith?
Oh man, I love him.
I...
Uh-oh. Oh, Judith. Oh.
Oh, she's seizing.
Eclampsia.
10 of IV diazepam, have another 10 ready.
With all the movement, we can't get a fetal heartbeat.
Putting on 15 liters by mask. Should we intubate?
Hold intubation. Let's try to break this. We don't want to mask seizures with paralysis unless we have to.
Okay. Cruise CTG isn't reading. Check with ultrasound. On it.
It looked like she was having a massive prolonged
with the-
decel there where baby's heartbeat was dropping. But again, they can't really tell because she is moving so much that it's not able to pick up the heart rate like reliably.
Nasally, what's the diagnosis?
Oh my God.
With the seizure, now with eclampsia.
Good girl.
Fetal heart rate is about 90.
Way too low.
Mom's stats are going down. Time to tuber?
I wouldn't say way too low. Yes, it is low. Okay, but I mean, if they were the reading that they were looking at looked like it was like 60, which would be way too low. But we're looking for that the normal variation is going to be 110 to 160. So that's what we are looking for. 90 is low, but it's not like detrimentally low, as long as caveat.
But wait, there's more.
As long as it is going to come back up. 90, where it's low and it's staying low, we are definitely absolutely very concerned.
Pulse ox is 88.
Okay, so now they're going to put a breathing tube to breathe for her because her oxygen levels are going down as she is
Pushing the
seizing.
propofol.
Once she's flat for intubation, we need to displace the uterus to the left.
Nasally, that's you. Big hug, both arms. Get the
Okay.
baby off the vena cava. Sucks is on board.
Because we need to stop the
After she's
seizure, but we
paralyzed,
also
the
need to
seizing
make sure that
stops,
the
right?
seizure
It
is
might
stopped
look
internally.
like that, but an ongoing
Just
seizure
because she's
will
paralyzed
still
and
fry the brain.
isn't
We
pulsing,
monitor
isn't
EEG.
clonic,
Wait and see.
clonic.
Paralytics kicked in. Let's go. Roll her to her back.
They're now pulling that belly over to the left because we have that big vessel running right through the middle there. And if she's flat on her back, the pressure of her belly and the baby and the amniotic fluid and the placenta is now all pushing on top of that vena cava that's running right through. So that's why we talk about sleeping on your side when you are later in pregnancy, is to take that pressure off.
Still seizing while paralyzed. It's non-convulsive status. She also has HELLP syndrome. Hemoglobin only 7, platelets down to 30.
2 units whole blood?
O-neg is going up on the rapid
gonna need
infuser
lots of
as we
blood.
speak.
Put the AP
They're gonna
pads
need
on just
mass
in case.
transfusion.
10 of
Lots
Decadron
of
IV
blood
push for
products.
the inflammatory storm.
Fetal heart rate up
Oh,
to
that was-
104. A little better.
Whoa, go back. That was not a fetal heart rate of
Fetal heart-
90. Whoa, my God, that's low.
Heart rate up to 104. A little better.
That's what we call
She should be upstairs with OB.
She will be. After we break the seizure.
Yeah, so the OB department, we are experts in pregnancy and birth and babies, not experts at seizures. Though sometimes we do see them for people that do develop preeclampsia in their pregnancy. Maybe they're being monitored. You can also develop preeclampsia postpartum, so make sure you're watching for those symptoms after you have your babies. But we're definitely not the experts.
Looks like it's a concern for the worst.
Eclampsia, refractory seizures, HELLP syndrome with anemia and thrombocytopenia.
Oh,
About as bad as it
did
gets.
you? That's like the equivalent of saying the Q word, being like, "Oh, it's quiet in here," and then everything goes to. Did he just say it's about as bad as it can get, and then she coded?
VFib.
So they need to work really, really quickly here because now the perfusion to baby and to mom is not there anymore.
Prep the belly. Get a baby warmer. Call the NICU. Start a timer. Charged. Clear.
Okay, so they have a shockable rhythm. So they've added the
Continue
pads.
compressions. We'll
They
check her
put
rhythm in a
electricity through, and they're going to go back ACLS. They're going to do
Going up.
compressions. So she
Robbie,
is
it's you and me.
physically
Ashley,
pumping the
what's the 4
heart.
minute roll?
Oh my God, he doesn't.
I'm not sure.
Oh,
Pregnant patient with a viable fetus. You have 4 minutes after cardiac arrest to save the baby.
And the mom. We don't call it a postmortem C-section anymore. It's a resuscitative hysterotomy to try to save them both.
But
gonna
she doesn't
see.
want any medical intervention.
That doesn't
Too
matter.
bad.
Mom and baby are both dead if we do nothing.
they can't get deader than dead.
Charge the 200. One more
Oh
rhythm
my
check, and then
God.
Abbott and I are gonna cut.
Okay, this is what we call a splash and dash C-section.
Okay.
So normally we would prep the belly, we would scrub the belly, let it dry, we'd put up the sterile drape. In situations like this where they just said you have 4 minutes to get that baby out and like no one's even ready to do a C-section, that's a really, really tight timeline.
Template.
Oh my God.
Good. First incision is from the xiphoid to the pubic symphysis.
See how they're still doing
through the
compressions
skin
while they're
to
doing the C-section? They don't
linear
stop for
alpha.
anything.
Units 3 and 4 on the infuser.
Second incision goes
And they're
through
doing
the
it
peritoneum,
vertical
exposing the
because
uterus.
they need access
Where
as
do you
quick
need me?
and as big as possible.
You're with the baby. Ellis gentle traction. Okay, making a small vertical incision through the lower uterus so as not to cut the baby.
Okay. You know he's reaching in to find baby.
Okay.
Okay, using scissors to extend
Is it just extending?
superiorly.
Okay. Oh, that's actually
Let's hand retract the uterus with me.
That's crazy. That looks exactly like it looks when a water breaks.
Give me some fundal pressure.
Okay, so fundal pressure because we are trying to get baby in the best position so that they can pull baby out. So you're pushing from above to keep baby down.
Breech position.
She said breech position, but the baby came out head first.
Baby's out.
Maybe she meant breech position in the
girl.
pelvis, but
Do we need
no,
to
but you need to.
Not yet. No, they usually pink up with stimulation and blow by.
Would probably move right to PPV, but
We're moving the placenta.
okay,
Sweeping to the
placenta.
left, trying to get it in one piece.
Looks intact. Nicely done.
10 of IV Pitocin to contract the
Perfect.
uterus.
So we're giving that medication and massage to try to get that
rate
uterus to firm up to
76.
control
Less
bleeding.
than 100 means we need a bag. Suction first.
Okay, to get that goopies out.
Hey, Jordan, charge at 200.
Oh,
Stand by for the next
oral
rhythm check.
suction. Interesting.
She grimaced. Good sign.
Bagging.
Pulse ox 45%. I've never seen it that low.
Okay.
It's not
Yeah.
as bad as it sounds. I'm more worried about the heart rate. Okay, get ready with an IO in case we need epi.
IO. So, in
Rhythm
the
check, hold.
codes on babies that I have been a part of, there's usually a neonatologist that is there, and they will actually use the umbilical cord that we just cut to actually insert almost like an IV into the umbilical cord because it hasn't healed up, it hasn't sealed up, it's still open. They basically take the clamp off, and then they will insert a line through the umbilical cord. So it's interesting that they would do an IO when they have a fresh umbilical cord, but I mean, I'm assuming all sites are different
Hold
here.
compressions.
So you've got a team working on baby.
Still
We're
VFib.
still working
Okay,
on
shock
mom.
Clear.
VFib, shockable. Okay.
Resume compressions.
Shannon,
Okay.
how's she doing over there?
Heart rate's up to 104.
At 1 minute, she's 0 for color, 2 for heart rate,
Okay.
1 for reflex tone breathing, Apgar 5.
5 out of 10.
No
Not
bueno.
great.
Pulse ox 58%.
Intubation?
Not yet. O2 sat in the 60s is normal at 1 minute.
Heart rate and pulse ox are trending higher.
Okay, so they are doing
Let's keep
PPV.
doing what we're doing. A little tincture of time.
So this is the trickiest thing that I find with a code on a brand new baby is that 1 minute feels like an hour and 10 seconds feels like 10 minutes. So in reality, they are doing everything right and baby is showing signs of improvement with those steps that they have done in the correct sequence. It feels like it's a long time. Even though everything is trending in the way that you want it to trend, it's like you want more instantaneous resolve of the issues. You want that baby to just be like pink and crying immediately.
Transfuse, 2 more units. She needs more red cells. and
Lots of
platelets.
blood products.
Blood loss from the uterus. Give me the left heads we got, please.
So here's the issue is that they're going to have a hard time stopping the bleeding.
Units 5 and 6 are in.
Down to a slow ooze here.
Hold compressions.
Looks like sinus. And I got
Okay.
a weak carotid.
Okay, cycle the BP.
Better
I
feeling.
think BP's going to be
Better
grabbed.
squeeze.
No seizure activity on the EEG.
That's progress. That's progress.
We're at 5 minutes.
Heart rate is 132. Pulse ox 79%. Nasally, the
So looks
Apgar.
pasty with the blue
1 off
lips.
for color, 1 off for tone, 1 off for respiration with hypoxia, total of 7.
Respiration scores for observed breathing, not pulse ox.
Sat of 80 is normal at 5 minutes. With no crying, she still gets 1 off.
She just scored the winning point. Apgar of 8 is pretty normal.
Oh, God, I love him. There's like no better sound than that. Look at his face. Look
Holy
at his
shit. What did I miss?
Oh,
Eclampsia with status, HELLP syndrome.
This is the OB
cardiac
or the
arrest,
resident.
Resuscitative hysterotomy.
I was in the OR with a septic twin C-section.
Oh.
Got your text 12 minutes ago.
Shit happens.
God, it can happen.
Resuscitative hysterotomy,
Robbie, I love
36
him.
seconds.
Impressive.
BP's 102/64. Hemoglobin's up to 9.
That'll do.
Okay,
NICU sending a
she's
team down.
improving.
We can take mom for
Wow, 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 wow. Oh, Robbie. That's heavy. That's a lot. Preeclampsia, this is one of the reasons why I often talk about if you are having symptoms of preeclampsia to really please get those investigated. We would rather see you and not need to see you than need to see you and not see you. Some of these symptoms, they don't come on all of a sudden. She may have been feeling those symptoms progressing over a period of time. If at minimum you go to like a pharmacy and you stick your arm in one of those machines and you check your blood pressure, but the best thing that you could do is to keep your provider up to date with what is happening with you in your pregnancy, and also why it's important to go to your prenatal appointments, because at those appointments, they will check things like if there is any protein in your urine, which is another symptom and a sign of preeclampsia. They're going to be checking your blood pressure, and not only just that one blood pressure, they're going to have a record of what your blood pressures have been and if they are climbing over time. And then they can say, hey, I'm a little bit concerned. I'd like you to go into labor and delivery and really check in on baby and see how they are doing, and then maybe bump up how often they are seeing you. And so free birth, or a wild pregnancy where you don't have any of those prenatal care pieces involved, is how things can escalate really, really quickly. So I think more so than just like looking at this as one isolated incident, we need to look at birth culture and how we are treating people and how people are perceiving the care that they are receiving during the most impressive time in their life, during their childbirth experience. Please take care of yourself and make sure that you are treating yourself and your body and your mental health with all of the love and care that you need. I have big goals. If you could subscribe and share this with somebody who might actually take something from it and might actually help somebody, that would be really, really appreciated. As always, guys, be happy, stay healthy, have fun.